Dear ladies and gentlemen, my greetings. Here we have Health Hackathon. That's first ever event of this scale in Lviv, Ukraine 2022. Please put your hands together to start the event. And I am honored to underline how special this day is today, especially for organizers, creators, and participants of this Health Hackathon that's starting right now. The peculiarity and focus is that for the World Health Organization, this is the first hackathon in the European region. Please, a round of applause to honor that fact. And this is the first ever Health Hackathon in Ukraine of this scale. Once again, this round of applause goes for you, dear participants. Health Hackathons in idea event where we're going to solve challenges, create new innovative products in healthcare. More than 200 participants from all over Ukraine, from Mariupol to Lviv, came together to create healthy solutions for a healthy future of Ukraine. And for me personally, as a moderator, I have a personal idea, a wish. I'd love us by the end of a hackathon to make those innovative, progressive solutions to be ready and to be ready for us to say that we decrease the diseases and improve the health. I'm sure we will be able to achieve our goal. Once again, a round of applause. Thanks to the organizers, to the creators of the event, to all the participants. Another important thing I'd like to comment on, all of us live and create within a unique time frame. It's a very challenging time for Ukraine, but that's a great time as well because we are moving forward, we progress, we go ahead to innovation, and right now we are fighting for this right. Our guys at the front line know why they are there, what they are protecting. They're protecting our lives and our rights to create new future in healthcare. Another interesting thing, I'd like to list the cities participating in the hackathon. Please, let's put your hands together for every city, both online and offline participants. And I'd like to greet our online participant as well. So let's create the atmosphere, the very energetic atmosphere for today. We also have a broadcast, and everybody from all over the world could join our broadcast. So dear participants from online and offline, this is Lviv, Kyiv, Poltava, Запоріжжя, Харків, Донецьк, Кропивницький, Черкаси, Житомир region, Волинь, Вінниця, Умань, Дніпро, Маріуполь, Рівне, Івано-Франківськ, Чернігів, Херсон, Тернопіль, and Lutsk. Please, let's greet them and let's greet our online participant as well, because it's easier for us offline here. We can meet face to face and feel the energy, feel the creative atmosphere that's here today. I hope that online participants can also feel this atmosphere and not at the same wave than we are. So right now I'd like to invite our video presenter, Dr. Viktor Leshko, the Minister for Healthcare of Ukraine. Have a look at the screen.
В Україні Health Hackathon. Сьогодні IT і охорона здоров'я є абсолютно нерозривними поняттями. Розвиток цифрових рішень не лише пріоритет уряду, а й один з основних трендів розвитку систем охорони здоров'я на світовому рівні. Рівень впливу діджитал-сфери на розвиток і покращення надання медичної допомоги аж ніяк не менший, ніж розвиток, наприклад, фармакології чи будь-якої з медичних наук. Фахівці різних сфер і професій можуть пропонувати і допомагати розвивати цифрові рішення в сфері охорони здоров'я. Від порівняно простих застосунків, що допомагають нам слідкувати за власним здоров'ям, рівнем цукру в крові, чи виховувати здорові звички або інформувати людей про загрози, і до використання штучного інтелекту, який здатний знаходити лікарські помилки або допомагати діагностувати хвороби на ранніх стадіях за найменшими ознаками. Ми у Міністерстві охорони здоров'я посилюємо політики, які спрямовані на збереження і зміцнення здоров'я, захист здоров'я і промоцію здоров'я на усіх етапах життя людини шляхом міжсекторального підходу, що передбачає залученість різних стейкхолдерів. Адже здоров'я – це не тільки про лікування, а у першу чергу про попередження хвороб і створення умов середовища, що сприяють здоров'ю, ранній діагностиці і своєчасному лікуванню. Ми працюємо над системними змінами, і нова мережа лікарень, а також нова система громадського здоров'я будуть вимагати ефективних інструментів для того, щоб наповну продемонструвати свої можливості. Окрім того, завдяки отриманню статусу країна-члена на новий рівень виходить партнерство, професійна співпраця і обмін інформацією з країнами-партнерами Європейського Союзу. Тож бажаю успіхів усім командам. Будьте рішучі, сміливі і креативні у своїх рішеннях. Адже інновації – це те, що також рухає нас до перемоги. Слава Україні!
Thank you. And now there will be one more welcoming speech in the video format for all the participants of the Hackathon. Dr. Hans Küger, Regional Director of the WHO for Europe. You're welcome.
Welcome, dear friends and colleagues, to the first hackathon ever of WHO in the European region. The purpose? To develop people-centered digital solutions that support a coordinated national digital health strategy. To help build a reliable, data-driven health information system. The end goal, simply put, is better health. And why do the solutions we come up with need to be people-centered and digital? Because such solutions save lives in emergencies, mitigate risks and enhance health. Think COVID-19 and how strong data meant stronger emergency responses. It is no coincidence we are doing a hackathon in Ukraine. Ukraine was an active contributor to a Digital Health Region Action Plan 2023-2030 and the resolution approved just days ago at the 72nd session of the WHO Regional Committee for Europe in Tel Aviv, Israel. The journey WHO is on is to support countries in making health systems digital and data-driven, aligning investment with needs and context. Ukraine does not require the same digital solutions as the UK, to give just one example. A few things to keep in mind before you start. Digital solutions must consider challenges, needs and trends of systems, patients and health workers. Digital solutions need to be safe, ethical and trusted. Otherwise, they will not be used. Digital solutions need to protect human rights and civil liberties. Digital solutions based on timely, actionable data ensure sound decisions that support decision-making for clinicians and policymakers. Digital solutions empower people, improve access to care, and boost health literacy. Digital solutions can never increase existing gender and health inequities, nor lead to increased marginalization. Please remember that. We often say that the future of health is digital. It's true. And the next 40 hours, you will be part of shaping it. Many, many thanks for working with us. And have some fun.
Thank you. So now there will be several organizational issues covered, and for a start we will speak about what Hackathon actually is. There are some participants who have already gone through a hackathon. So who does know what the hackathon is? There are not that many participants. Please raise your hands for me to see you better and to know for whom my information is now coming. So I guess that 10% of the participants do know what a hackathon is. Do you know it or have you participated? Raise your hands those who have participated in the hackathon so we can see even fewer hands. Some of you have probably Googled the information about what the hackathon is, but for those who don't know what a hackathon is a very serious thing, and it will have serious implications and serious consequences, I'm sure. But to be more serious, I'd like to say that hackathon is the kind of a brainstorming event. You will have a very short period of time to solve global tasks, but you will be able to manage this because you will be working in a team and you will have a chance to work with experts, with the representatives of different organizations, and with your mentors. You will be helped, and everything is built and structured in the way for you to be able to find modern, creative, and brave solutions. And at this hackathon, you're going to solve 5 cases, 5 tasks in the healthcare field. And already on Sunday, on the 25th of September, you will have a chance to present these solutions. And these are going to definitely be creative and brave solutions, but the main precondition is that they are efficient for us to start implementing them, bringing them into life right after the completion of the hackathon. So who do we have to thank for this hackathon? Who is the organizer? And who the participants are? Well, the participants are you, but the hackathon is being implemented by the consulting Civita company, innovation company Radartag, the network of academic startup incubators YEP, in partnership with the experts of the Academy of Family Medicine of Ukraine and Ukrainian Startup Fund. And it is implemented on the initiative and with the promotion of the World Health Organization in Ukraine and with the support of the government of Canada. So let's applaud. Thank you. And by the way, I can see that the applaud is now more saturated, and as a facilitator, because I have the microphone in my hands, I will keep asking you to applaud from time to time, and this applaud will have some functions to inspire someone, to support someone, and to wake someone up. So I'm definitely sure of the fact that you will be a success. I do believe in you because I know that the participants with a great capacity have come here, and the teams will produce the strongest solutions ever. So once again, let's applaud, but this should be a very strong and powerful round of applause for those who have been brave, who have got registered in today's hackathon and who are participating in it. So this round of applause is for you. Thank you. This means that really you have a very high potential. Let me stress that for the World Health Organization, this is the first hackathon in the European region. So let's also applaud to the World Health Organization. Thank you for being brave enough to organize this sort of event. And now the applaud will have 2 functions of support and relaxation in the official atmosphere, because we will speak about serious things, but we will be brave enough and we will need to support a positive atmosphere here. So let's also applaud to the people who have implemented this hackathon. Civita Radartag. Thanks a lot to you for this. Let's continue. So what about our agenda? Let's go over to the agenda and please focus on it, on the agenda of the hackathon. The agenda is structured in the way for you to be able to speak to experts, to work at the solutions, to develop the solutions, and to get ready for the speeches. So you will be able to do this in a high quality and efficient way. We will be working for 2.5 days, and starting with tomorrow, we work full days from 8 a.m. to 10 p.m. And the morning will start with 2 workshops tomorrow. The first one is the ideation workshop, which means working with the ideals. And you will have to work with the expert, and he will guide you for you to be more brave and more efficient. And in the morning, there will also come a pitch training, which is obligatory for those of you who are going to deliver the presentations of the solutions. And already on the 21st of September, in the evening, we will be assessing the presentations and choosing the winner. Also, from 10 to 11 a.m., there will be mentor meetings. Okay, and actually this will be from 10 a.m. to 9 p.m. Please, you can get registered already today for these mentor meetings. This is important. And of course, you will have some breaks, coffee breaks. There will be lunchtime and dinner. And I will be warning you about this. So everybody is going to be happy with everything, and the atmosphere will be absolutely perfect for creativity. There comes a round of applause again for you to show that you are ready. Now comes the most interesting point. The prize fund. I know that you know what the Hackathon's prize fund is. Let me mention that it is $6,500. And this budget will be divided by two teams. So the winners, $3,000, $2,500, and $1,000. So actually between three teams. What about areas and locations and venues? We have the working area, which is the room where we are now staying. Here we will have the working atmosphere. Also in the corridor, in the lobby, you have the relaxation area, and there are even some fitness devices, so you can use them. Then to the left, there is the mentor meeting room. To the left, along the corridor, you will definitely find it. If not, then address the volunteers in the T-shirts and they will guide you. To the right, there is a place for coffee breaks and breaks. So to the left, the mentor meeting room, and to the right, the coffee area, and in downstairs there is a restaurant for lunch and dinner. And all this information could be found in our internal chat, because the Hackathon has got the internal chat called Slack. I hope everyone has already got registered there. Is there anyone who has not yet registered? You can scan the QR code and get registered. If you need any help, please address the organizers or the volunteers, and they will definitely help you with this. Slack is the internal chat, and in this chat you will have all the information, the agenda, any messages you need to take into account, all the tables, any work information will be available in that chat, so please get registered there. And during the registration, you need to mention your name and surname, and when the teams are shaped up, you also need to add the number and the title of the team. This is also important. So we are going to go over to the next point. Any questions concerning the registration? No, okay, everything is fine with Slack. So now here comes another point. How do the online participants have to work? Welcome to all the online participants, because you're actively participating in the hackathon, but you're doing this online, so probably you have some advantages and some disadvantages. You are staying at home, you need to wear nice clothes, you can just be doing it with your favorite cup of coffee, but your active participation is also going to contribute to the work of the teams. Maybe we will have even blended, mixed teams from online and online participants. And by the way, you will have Zoom, the Zoom area, and then you will have your coordinator. This is Daria Lapin. She will be guiding you, developing your team, and creating rooms for meetings with mentors and for working in a team. So everything will also be supervised. By the way, as far as colors are concerned, the colors of sweatshirts, the participants of the hackathon are in dark blue sweatshirts. Have all of you got them? Why am I asking? So, if it's possible, you need to wear them, and the blue ones go for the participants, while the gray ones are for trip mentors, speakers, and organizers. For all of us to be clear about that. And here is another video address for you, and after that we're going to start working with cases. You will have the presentation of the cases, and I think that you will choose for yourself the task, the case that you're going to solve during today's hackathon. So let's watch another video. Yeah, Dr. Jana Habit, representative of the World Health Organization in Ukraine. You're very much welcome.
It is my pleasure to welcome you here in Lviv in the first health hackathon in Ukraine. This event is a part of comprehensive WHO support to Ukraine and to primary healthcare in particular. Ukraine has always looking for innovation and future, be it the DIA app and related solutions, or using apps to guide access to medicines at the time of war. There are many such examples, but also how e-health has advanced as part of the health reforms over past years to improve data exchange and transparency in healthcare. The objective in coming days is for health and information technology folks like you to find new solutions. These 48 hours are dedicated to you and your bright ideas and talents to tackle the challenges around health promotion, disease prevention, mental health, healthcare management, and health workforce support. Please be brave and ambitious in your IT solutions. You can imagine apps that help to make healthy choices, solutions to diagnose or manage disease, as well ways to improve communication with the healthcare workers. Literally, the sky is the limit. Innovate and invest time for future Ukraine and improvement in health. Дякую.
Дякую.
Thank you. So, here is my question. What is the mood of the participants? What do you feel like? You can show your mood with your applause. I realize that this part of the room is more enthusiastic about getting the prize. What about this part of the room? I can already see the faces of winners. Okay, but I'm joking. Of course, I'm just trying to make you feel relaxed, and because the presentation of the case is going to be the main point when you come to understand what tasks you will have to work with. You will need to choose only one case for yourself to develop a team, and this is all coming. So here is the point of time when you need to get ready to generate ideas, to be creative and brave. Are you ready? So once again, let's support those who are going to deliver the presentation of cases. I'm making some pauses because we really need to support the people who are going to deliver the cases. You remember that this is the first hackathon of the World Health Organization in the European region, so they are really afraid to deliver their presentations. But let's go over to the cases. So I understand people have started smiling more, so let's go over to cases. So case number one, healthy lifestyle. And the case is going to be presented to your applaud by Andriy Skipansky, the national coordinator of the program of non-infectious diseases of the WHO Bureau in Ukraine.
Ми з вами будемо говорити про промоцію та
So, good afternoon to everyone, and we're going to talk about promotion and strengthening of improvement of health. And I will start with the problem which we all try to solve using some IT solutions. And this is a problem we are well aware of and we live with. It's about short life expectancy and bad quality of life, poor quality of life. Ukraine faces almost their shortest life expectancies throughout the European region. We live about 8 to 10 years less than Europeans. And we need to do something with this. The diseases that we fall ill with much earlier than people in other countries, make their quality of life worse. So we need to gradually settle the problem. This is one thing. The other problem is that we need to find out what the reason, what the cause of this problem is. What causes early mortality and poor quality of health and life? We do know that most of premature deaths are caused by chronic diseases. And in Ukraine, the statistics shows that 91% of all premature deaths are caused by non-infectious diseases, which are cardiovascular diseases, 63%, 15 for cardiovascular, for uh, other like oncological ones and traumas, 5%. Then the next question is what causes those diseases, non-infectious diseases? And we have decades of research evidence. So our information is already evidence-based, and it shows that there are the key four risk factors in those non-infectious diseases. The first one is, and be careful, this is tobacco. Then comes alcohol, then comes unhealthy diet, and then physical activity or sedative behavior, low mobility. So there are four main risk factors that affect our life and cause chronic diseases. And then comes a good piece of news, finally. All the four risk factors are behavior related, and they could be prevented in case we modify the behavior. And that is what promotion and strengthening of health is about. These are the tools that help us to better learn what our health is like and to improve it in two most important ways: by changing the behavior, both the individual and the populational one, and the regulatory policy. So we'll speak more about the change of behavior. Our task is simple and not simple at the same time because it refers to the promotion of the healthy lifestyle, informing about the risk factors, deprivation of those risks, reduction of those risk factors, adding the right choices in our daily life on the individual and populational levels. How do we stop smoking? How do we choose how much fruit and vegetables we eat every day? How do we move more on a daily basis? What pressure levels do we have? Are we not facing the risk of hypertension? So a lot of daily questions may get digital solutions. So I wish success to all of us over the next 48 hours. Thanks a lot. Thank you, but Andrei, please stay on the stage because we have the Q&A session. So in case there are questions to Andrei, who just presented this case, you may ask the question to clarify it all right from the beginning. So are there any questions among our offline participants? No questions. What about online participants? Are there any questions to Andrei? Because you also have a chance to ask questions. No questions. So, Andrei, thanks a lot for your presentation of this case. And for all those who have come to like this case and who want to deal with it, you may actually start generating ideas already now. But let's go over to the next case, which is early detection and prevention of diseases. And let me welcome Yulia Novak, an expert of the primary medical aid of the WHO Ukraine. Good afternoon to everyone. Let me start with a question to the audience. What do you think? What is the difference between the first case, which has just been presented by Andrei, which is healthy lifestyle promotion, and the second case I'm going to present to you right now, which is about prevention of diseases? Can you give a quick answer? I can see a hand, so could we somehow give a microphone to this person? Do we have another mic? Well, in the first case, the person probably is not sick, but in the second case, she's already sick but doesn't know about this. Well, not exactly. Any other option? As an option in the first case, the person is asked to go to a doctor, but in the second case, some device itself detects the disease. I can see that we have a lot of hands. Thank you. This is an interesting assumption. Let's listen to some other options. I can see all the hands, but I have only 5 minutes, so let's listen to the third. It's all about infectious, non-infectious diseases. And um, I think that promotion and when you are urged to do this, and prevention is already not about the motives, but about actions. Well, thanks a lot. It's a pleasure for me to see that there is such a high level of interest in both topics. And most probably we're going to have a lot of interesting ideas coming from us. But of course, there was a tricky, provocative question because, in fact, these two topics are hardly distinguishable. You cannot give a clear borderline between them, showing that there is a clear difference between the two topics, because the second one comes as the logical continuation to the first one. So the teams that are as ambitious could actually work with the topic related both to the first case and to the second challenge at the same time, because prevention of diseases is a system, a set of actions which presupposes identification of certain risks of diseases and prevention of the development of those diseases, both infectious and non-infectious. So let me start with chronic ones. For example, asthma, ischemic heart diseases, oncological ones, diabetes mellitus, and some other things. These are all the examples of chronic diseases. What could be the solutions for preventing or early prevention and early detection prevention of those diseases? So the first solution is screening. Screening aimed at early detection. What is early detection? Early detection means that a detection comes even before the first symptoms are manifested. It's important to do the screening at the stage when the people yet do not have the symptoms, to find out the risk groups and to work with those groups to involve them into the healthcare system. We're looking for such solutions in order to embrace as many population members as possible with such screenings, to motivate people to do this, and to interact with the doctor for the sake of motivating a person to keep doing everything in the right way, to act and not just to know, to have the knowledge of the fact that she is or he is within the group risk. That's why we're going to be very grateful to any ideas in this direction, any solutions that you may suggest to solve those problems. And another block of the second challenge goes about communicable diseases. So it is all about vaccination primarily. This is not about the public health and the health of the nation, but national security as well. This is the most efficient and the best intervention aimed at prevention of communicable, non-communicable and communicable diseases, together with the provision of fresh water. But unfortunately, Ukraine cannot yet reach the recommended level of vaccination, because the recommendation of the WHO says that 95% should be vaccinated, but this rate has not been reached. In practice, this means that some part of the population is not protected and that we have vulnerable groups of the society that remain to be the risk groups as far as communicable diseases are concerned. And these are the risks that could be avoided, so we are here to help avoid those risks and to make to arrange healthy environment for the whole population and to secure all our residents against those risks. So we're looking for the ways of motivating people to get vaccinated. We're looking for the ways to work with family doctors, for them to be more actively involved in the vaccination. And we are also looking for the understanding and understanding of the matter of vaccination, and generally we are working to improve the level of vaccination. And here comes the last point that has become probably more in the focus of our attention under martial law. This is outbreaks of communicable diseases, and we would be interested in having any solutions that would ensure a supervision of such outbreaks and detecting the contacts of the person in order to prevent outbreaks of communicable diseases and their development. I'm going to stay here for all the 3 days, so I will be happy to communicate with all those who are interested in this topic. And I'm really very much encouraging you to communicate with other mentors. We have a great team, both online and offline. And that's just a very good occasion to get acquainted with the professional community and just interesting people. Thanks a lot to everyone.
Please, that's great that you started communication already, but do we have any questions here in the room? Do we have any clarification questions? Please raise your hands, ask your questions. Do we have any initiatives or maybe a benchmark of what's very topical for these two challenges today? I can't say that anything out of these three topics, three directions that are listed, screenings for chronic diseases or vaccinations or the disease breakouts, they are all equally relevant and topical and important. So if you haven't identified or if you don't know which directions you'd like to select, just select based on your interest. Thank you. Any other questions maybe from the other part of the room? And also, I'd like to address the online participants. You can also ask your questions should you have them. So if you'd like to clarify anything, just let Daria Lapan, your coordinator, know, and she will pass on the question or include a question here. Daria, do we have any questions from the online participants? Yes, we do. So let's listen to the online question right now. We need to just voice the question. All right, so please ask the question. Hi, can you hear me? Yes, we can hear you well. Our greetings. Thanks. My greetings to all the participants, to all the organizers. I have a very practical question to both cases. I'm sorry, we can only give you the answer to the second case and challenge. Maybe later on you'll be able to ask about the first one. All right. Is it possible during the hackathon to only work with your idea, your mission, or can we duplicate the success cases from around the world? We do not limit you. You can refer to any best practices from all over the world in order to see what works best, what's proven, but you need to be and to present it within the Ukrainian context because it should fit the Ukrainian realia. Because, as it was already mentioned by one of the speakers today, what works in the UK is not guaranteed to work in Ukraine. So we do not forbid to take and develop ideas, but your idea should be working and workable in Ukraine. So just briefly, there is a digital solution for combating smoking, and we could take and implement it as best practice here. Yes, theoretically, yes, it's true, but the question is how relevant it is for Ukraine. If you think that this would work, we could also consider it during the hackathon. We have a jury that will be assessing all of the solutions based on different criteria, including the innovation and how relevant it is for the Ukrainian context. Should this be the best solution out of all of them, then you have all of the chances. Thank you for the question. Thank you, Yulia, for presenting the case. By the way, it will be fair, according to our agenda, to have 3 questions to every presenter. So 2 questions during the next challenge and case presentation will go to the online participants. So please listen carefully. You'll be given an opportunity to ask questions. 3 questions, 3 clarifying questions to the presenter. And we are moving on to the next case. This is the online case, which will be presented online. This is the mental health support, and I invite Alisa Ladik Brizhlava, a head of the mental health program of the WHO Ukraine, to present this case. Could you please let me know if you can hear me? Yes, we can hear you and we can see you as well. Great, thank you. Dear colleagues, dear friends, I'm happy to greet you here on behalf of the Mental Health Program of the Bureau WHO Ukraine, and thanks for being interested in this mental health topic. On the one hand, when we're talking about the relevance, probably we don't even need to speak about the relevance of mental health, because here in Ukraine we can feel the impact of mental health on all of the areas of life. On the other hand, I'd like to stress why mental health is becoming more and more discussed in the world, and we are raising awareness not only during the war but even before the war, and it will be especially important for the further development of Ukraine during the renovation stage, because mental health is a universal right of every person as a part of their right for healthy life and implementation, realization of their own potential and their other rights. According to the WHO estimations, every fifth person, that's 20% of population in the work conditions, could have mental disorders, from slight to more complicated. So it could be stress or post-traumatic stress disorder. This could be related to psychoactive intakes. So the mental disorders could grow twice, and apart from those that I already mentioned, the majority of population feels stress as insomnia, tiredness, chronic heartache without any identifiable reasons. These are very normal reactions to the very abnormal situation, and for the majority of people, their symptoms would decrease. They could decrease, and they should decrease only upon the condition that these people can find the solution for their basic needs, meet their basic needs, and find the support that they need. And mental health is also very important for the welfare of community, social safety, security, and productivity of people, and their involvement and contribution to the renovation of Ukraine after the war. So care for mental health is our common goal, both for the state and for all of the community. All of us should be aware of our mental health. We need to learn how to do stress management, and not only know but also actually do the active stress management, learn how to help people around us, and help them when we should ask for help, and what kind of services we need. These services should be available and accessible to all of the people, so that will be safe, secure, and accessible to all people. And this mental health support that people need right now should be available. And today we have lots of effective instruments, practices, protocols, and measures to support and help people with mental health, prevent mental disorders, and mitigate the existing ones in the WHO. We have a number of tools to help. We have best practices that our partners can share. Just a couple of examples. Briefly, this is basic psychosocial skills that help people of all of the support professions and expertise, those who live through the loss of different areas or characters or types. This manual will help how to establish contact, how to conduct communication with respect and understanding. We also have another tool for stress management that will help people in groups or individually in personal learn how to manage their stress level, how to help other people around you with the help of these skills. We also have a wide-scale MHK program with the help of which we teach family doctors of the primary care to identify mental disorders and to provide timely help. So the biggest challenge at the moment is to find the solution. How can we achieve the situation, all of the best practices and this knowledge works in Ukraine, and how could we switch from the knowledge to behavioral changes? Because we know that healthy sleep is very important for our effectiveness and productivity, but knowing that, do we still go to bed at 10 p.m. or 11 p.m. or on time? And among lots of resources existing, informational resources existing all around us, it's important to understand which skills are evidence-based, which best practices are evidence-based, which are not, and how we can switch and change the behavior to overcome stress, where we can find this type of help that's required right now, that I need at the moment. The initiative for mental health and psychosocial support in Ukraine, Volodymyr Zelensky initiated in May 2022, also helps. So we, as WHO organization, our partners also support this initiative, and your help, your involvement is critically important to find relevant, innovative solutions to all of these challenges. And I'd like to also add that we have my friend Natalia Yukorenko here in the hall, who could help and consult you there on these questions. Thank you. Thank you. Thank you. That was Alisa Ladik-Brazhalova. Please stay in touch because we could have a couple of follow-up questions. Are you still here? Yes, great. As I promised, dear online participants, you have the right to ask two questions first. Do we have two questions from our online participants, Daria? Right now, do we have anybody online with questions? Yes, we do. So please, who signed up for asking questions, please start talking. We will see you, we will hear you on the screen. Good afternoon. Do we have, or do you have at the moment, any active programs for mental health renovation for military during the rotation or when they come back from the front line, please? Please, Ms. Halova, thank you for the question. So when we're talking about military, we treat military men and women as a part of population. All the programs that I already mentioned also include a help to, and should work for military as well, but there are some separate programs from our partners that focus on providing help for this group of population. WHO says that all of the programs that we implement that are listed should work for all of the groups of population, including military. Thank you. Thank you. Thank you for the answer. Another question online, please. Voice your question. Please, go ahead. Bon appetit. because we can hear somebody eating, but could you please also voice your question? If you signed up to ask the follow-up question on mental health to the mental health expert, please ask your question right now. Yes, I can see you keep your priorities straight. Yeah, it happens. That's a normal situation. That's okay. So, fine. Then one more question goes to the offline participants. This part of hall, do you have a follow-up question to Ms. Ladek-Brazhalova, mental health support case? No questions. No, we do have question here. Please. What's your question? Good afternoon. What do you think about the latest research on post-traumatic stress disorder? Are there any measures and tools in Ukraine for promotion of that? Please, we are waiting for the expert's answer. Sorry, I didn't hear your question fully. Could you please repeat? Could you please ask a very clear question? What do you think about MDA therapy, the latest research in this respect on the post-traumatic stress disorder? Do we have anything in Ukraine related to this therapy? MDMA therapy, right? What did you mean? Well, as far as we know, there are no active programs or no active steps in Ukraine in this direction. So it's hard to say about any specifics in this research. Another question, please. Good afternoon. Psychiatrist community, did they participate in providing the solutions and shaping the solution for this threat for the community that's going out of occupation? Because even mobile teams that we launched, people are coming out of very difficult situation and psychosomatic. And no mobile applications or games, gamification approach won't help here. These people need medicine, they need psychiatrist consultation and help. Thank you. Thank you. The community of psychiatrists is also a part of solution providers, and we are open to any discussions and participation here for the pre-medical help in any primary and secondary other parts of care. They are also a part of the national program of the mental health and psychosocial support. Another thing I'd like to point out that it must not be like drugs or medicine prescribed, because we have evidence that psychosocial intrusions could be in therapy as effective as drugs prescribed. It depends on a person. Some people would need to take medicine, and some will, for some therapy would be enough. Thank you. Thank you to Ms. Ladek-Brazhalova for her presentation. And you'll have the possibility to ask follow-up and other questions later on. Right now we are focusing on the presentation of cases. And the next one is a convenient and safe patient-doctor cooperation. Invite here Igor Zastavny, family doctor, head of the medical management program, Academy of Family Medicine Ukraine member. Hi, do you watch any stand-up? stand-ups? Have you heard? Great. Just that I feel as a stand-up comic here right now on the stage. I'm just a family doctor, and as a stand-up comedian, I'd like to be as open as possible with you. Right now, I work in a city as a family doctor. I spent 4 years working as a family doctor in a village. You probably can't even imagine what kind of experience that is. That's a very funny and great story. Do you know how many patients during the infectious disease breakout I had per day? 30, 40, the answer is yes, 40 to 60 patients for 6-day working hours, and our pediatricians, 80 to 100 patients. Patient appointments per day, yes, that were around 7 of tuberculosis, yes, thanks, but well, it's about 50% of those would visit during the first 2 days of the flu disease. Do you have any chance during the first days? No chances for me, of course. So the question here, how can we decrease the load? How we can improve our patient-doctor communication and optimize that? The majority of things in the history of mankind are already existent. There is no need to invent a bike. We just need to improve things. One of the facilitating things is family medicine, and the basic rule here is active and autonomous, independent patient. This is when a patient, about 30% of cases, if they are not too difficult, complicated, a patient could solve on their own. What do patients need? You as a patient, what would you need to be able to solve things on your own? Google, yeah, cool. Try typing in coronavirus in Ukraine, and link number 3 would be why I'm going to die of coronavirus. So Google is a cool tool, but a patient needs relevant and evidence-based and truthful information. So they need to understand how to communicate with the doctor and be able to solve some of the challenges on their own as well. A pregnant woman, where could she find information about vaccination? Do we have anybody with pregnancy experience here? Yes, they should address the family doctor. Why? Because we have, we live in the 21st century. We have chatbots, cool other instruments. After the vaccination, there is a story, a very difficult abbreviation, PPE. So post-immunization emergency, when after vaccination you run fever for longer than you should have, or your hand is swelling. It happens. You as a patient, why couldn't you be aware about that and have control over your condition? I don't know. Another aspect of family medicine I'd like to discuss with you is shared decision-making when non-paternalistic approach. Have you ever met the doctors who would say, keep silent, do everything as I say, eat all of the medicines that I prescribed, and don't voice your opinions at all? You met such doctors, right? So we are very against that. The decision-making should be shared in common. When can we do that? If you have enough, yes, information, that's right. You need to have enough information, but this information should be adequate. Stats, facts, and not why you're going to die kind of information. The next thing, in the 21st century, we have lots of AI elements, artificial intelligence, and other buzzwords. But this artificial intelligence usually is not present in this facilitation of doctor-patient communication. Why can't we monitor your oxygen, your body temperature indices, just to show you a check mark showing that you're fine? Do you know how we control the coronavirus patients? We give them a piece of paper where they list the threatening symptoms. And the pre-last thing I'd like to voice, another aspect of family medicine. Why can't you get all of the information, what kind of examinations you need to pass once per 6 months to always be healthy? Because it doesn't work. There is a so-called quarterly prevention. The more we examine, the more we find. The more we find, the more we intervene into your body, the more we intervene into your body condition, the worse mental health condition you have. The disease risks rise. So we need to work with the groups of risks and do the screening examinations there and so on. And the last thing, another minute. This is let's cover all of this into electronic healthcare system that works in Ukraine. If you know the system, if you tried it out, it consists of two things. This is central database, placed somewhere in Kiev or something. And the second, the so-called medical informational system. Database has lots of potential, but are they being used? No, it's not used to all of its potential, but we are moving forward in this respect. We're trying to. Can we impact that? No. What we can impact and influence medical information systems. So I'm not giving you ready-made solutions, but I'm trying to give you food for thought. So I suggest and I offer this as a problem solution. How can you as a patient be more autonomous and independent? How can I as a doctor spend more time with my wife and my cats? Thank you, Igor. Questions? I want to give opportunity to online participants. Do we have any follow-up clarifying questions to this case? Please ask your question to your online participant. Yes, we have online questions. So if you are ready with the online question, please go ahead. Good afternoon. My name is Palusha, and I'm online present here as a part of a team is offline. Now about the patient-doctor communication, could you please share if we're using the system of medicines and drugs labeling? We have a project like that where with the help of this labeling, we could scan the label and get the information about that and get the next steps. The patient could receive the information or even then follow-up communication with the doctor that assigned the treatment. So what was the question? Well, that's a cool idea in the project, labeling project that I have. In my medical information system, I even have the possibility that we can select the drugs for treatment automatically. But so the question is, for example, when somebody came to you and they want to get vaccinated, this patient scanned the QR code on the label, and in the future they received the link to further communication with the doctor. So first of all, they checked the QR code and they validated the prescription, they validated the drug's efficiency, and then they have a link to communicate. Yes, thanks, great story, great solution. So the trust between patient and doctor would be better and would arise because they could have a validation based on QR code, but automatically they will have a link and use this link to contact you. Yes, great, thank you. I just need to say that that's a great project, well done, but I'm just a family doctor, so I don't understand the all of the intricacies, but I think that's great, and you need to move forward in this direction. From my point of view, you need to develop it in the direction that the person could automatically communicate with, for example, Center for Public Health, where they could send those. It could be not only after the vaccination. For example, there is an acute condition after I took antibiotics, and I think that that's not a valid drug. Yes, so the last thing, yes, for example, if a person before the drugs intake, they validate the effectiveness and they validate whether that's a falsified drug. Yes, that's cool idea. Well done. That's a great solution. Thank you. Thank you. Another question, please. You raised your hand, so the microphone goes to you. Please, maybe try asking it very loud. The interpreter doesn't hear the question without the microphone. That was the question to the next case and challenge, but thanks, your initiatives also a very cool one in your project. Please, we have one more participant. Please feel free to ask questions. My name is Andrea, and hello. Could you please share, for a startup project, is it difficult to get access to the system with medical data? Because for the interaction, we need not only get the open access data, but even maybe some stats that you are researching, because medical data is a patient protected data. Yes, medical data are protected and secure. It's same as military data. That's difficult. But if you're a medical information system, they could get certified at the central database and get a relevant license, permit, and access level. On the other hand, these medical information systems don't use this data that they have for their own. Just a couple of words. Once a doctor from Finland visited us, and he had a story. They code CPC in the primary care, so they code the data and they get the feedback. You diagnosed stroke too late, so they get this based on the data. They get this feedback. But if you are certified, if you get access to this kind of data, you could get this kind of information.
So I'm a family doctor, so I don't know whether I've given the answer to your question. Okay, anyway, thank you. Thank you for the presentation of the case. Thank you for your answers. This is great that you've got questions, that you're active. And by the way, for all those who haven't even seen the details of the presentation, will have to know that all the presentations will be sent to Slack. So in our internal chat, you will have a chance to have a look for the details in case there is a need for that. But the main thing is your communication with mentors. So your work will definitely be efficient and effective. And the final case for today, please, you applaud. Effective cooperation of doctors. And here is Irina Voloshina, the family doctor, professor, and the member of the board of the Academy of Family Medicine of Ukraine. You're welcome. Thank you. So welcome to everyone. So my feeling now is, and probably you have the same feeling, that resembles very much the feeling of the people who were going from horses to changing horses for cars about a century or several centuries ago. And where is my clicker? So today I need to present the challenge of interaction between doctors. And let me start with the question to you. Can you please tell me, who of you has never gone to a doctor? Never gone to a doctor. So no visits to the doctor. That's an unreal situation. They all have been to a doctor. The same can be told about the hospital. And anyway, we were born in hospital, so all of us have been to a hospital. And let's have a virtual seance session of telepathy. Ask a question. Um, the question of should be related to where is the doctor trained? Where from does the doctor get the knowledge? So challenge number one for you is going to help HCPs and doctors and nurses, medical nurses, to, well, probably create some platform or create some applications to ensure uninterrupted professional training, because we are learning. This is lifelong learning. And the doctor who was trained just in a medical health institution and educational institution and then doesn't attend any conferences, well, it's a sad story, and I would not wish to get to such a doctor. So, first of all, the quality of medical services provision depends a lot on the qualifications and competences of the doctor. The other point is that I would ask you to raise your hands if you think that we have ideal conditions, not just in terms of the knowledge and expertise of family doctors, but also of hospitals and inpatient, outpatient facilities, and they don't need to be improved. It's a pain in the neck, right? That's what I've heard from the room, and that's true. Because we are all facing the situation when the service of provision of medical services interaction requires a certain improvement, and it's very good. Then, for example, my colleague Bogdan Michalewski has come here, and he has become a sole proprietor. I'm also a sole proprietor. I worked as a sole proprietor in the occupied Berdyansk. Ihor has such practice. So thanks to the reform, we have been able to launch our practices of family medicine, and we are proud of this. But that doesn't mean that we wouldn't like to improve the services and the level of services, in particular by way of digitalization. Because, for example, I can communicate with my team in a remote way, and the issue of a virtual clinic is highly relevant. It is really relevant to communicate with your colleagues, to get the feedback from patients. And Ihor, in his previous presentation, mentioned that it's also good to efficiently communicate with the patients, and the service depends highly on the expert support and on the digitalization in particular. Please show the next slide. So, your solutions could be different. For example, you could create a platform for experience exchange. How is experience exchange now? In social media, we have a closed group, a closed community, closed the notebook of a family doctor with 30,000 doctors there. We are sharing our cases. But if it were possible to do this on a platform, that would be great. The other thing you can do is to create a tool that will help doing supervision and clinical audits. Supervision is the term used by my colleagues, psychiatrists, but what does it mean? What about the doctor who treats you? Is there any control over his work, and is it necessary to arrange any control over his work for this person to tell the doctor that suppose you have a burnout and you need to stop and to have some rest? So now we have a chance of developing the new culture of supervision, the new culture of clinical audits in healthcare facilities. And this is an absolute know-how for Ukraine, just on the initial stage. So you can also create an application where the HCPs could have peer-to-peer communication, because HCPs are a closed community, so it's very difficult. But you can also improve the ways of healthcare. Is this the last slide? Yeah, it seems to me that's all for me. Thank you for your attention, and I will be happy to take your questions. Yeah, I can see some questions. 2 questions here. So in this part of the room, and let's start with you. Good afternoon, I'm Ivan, and you've asked a question concerning availability of supervision, but the answer is not quite clear. So could you tell us what supervision is like? Is there any licensing, quality control in place? So what is the official status of supervision? I've just said that it is only at the initial stage of development, and thanks to the WHO and their initiative, now the basic document is being developed. I don't know if that can I tell about this? Yeah. So we have already developed the concept note and the recommendations for clinical audits and the procedure for clinical audits. So this document is going to be discussed by the Academy of Family Medicine, and we are going to discuss with our colleagues what kind of procedure we should apply, because it shouldn't be just inspection. It's like the one in one of the Soviet classical literature pieces about the Gogol inspector. But this should be more like audits in the UK, in other countries. Should be helpful. But how does it work? For example, there comes COVID-19. So how does my family doctor know how to treat it? From the internet? Or, well, doctors need to keep to the principle of lifelong learning. And it's really a good question, what platform could be trusted? Because in the market of providers of medical education in Ukraine, I can tell you about this informally, and I know definitely that there are a lot of people who have this information in this room, that the platform has just been launched. We have the register of providers of ongoing professional education. Our organization can be providing educational services, and any medical universities can be training doctors using the evidence-based medicine data and using some applying some requirements to education and training. But you know, some do follow the criteria and the requirements, some do not. As far as supervision is concerned, it's a sad story, because among psychiatrists this culture has already been developed, and it's very good because psychiatrists face burnout very quickly. And by the way, family doctors also face burnout very quickly, but we don't have the system of supervision when I can approach my colleague, Igor, let's say, or somebody else, and tell that, you know, somehow I have started taking wrong decisions, and I'm very much concerned about that. Please advise something to me, and we discuss this issue. And this is a good thing. This works among medical staff throughout the world. And it doesn't mean that I'm a professor and you're an ordinary medical doctor. That is all about the system of trust, of professional culture, and mutual respect. I hope that I have answered your question. And here is another question, and we are about to conclude. And here is another practical case. Europe has now a very good practice of multidisciplinary teams. So in one of the institutions of Lviv, it is being implemented, this concept. So how does supervision take place? Because the number of doctors per unit, in particular emergency medicine units, are limited. So we either have to duplicate the effort of one doctor, or there will be just one for several doctors. Thank you for the question. By the way, I mentioned to speak about multidisciplinary teams, but I've forgotten to within my presentation. So if we speak about the primary health care, when the doctor works without a team, this is another challenge and a very sad story. That is the so-called God syndrome. And the number of doctors' mistakes is going to be huge, and the burnout will come very, very quickly. So this is again confirmed by the evidence-based medicine. So we need to create multidisciplinary teams, be it a person with hepatitis or with TB, or a person with any disease and problem that requires additional consultations. We always need some additional help. And by the way, each of you, each volunteer, could be invited by me to different regions with our family doctors, to different regions of Ukraine, small villages, small towns where people are left with no primary medical care. But in our car ambulance, we have one place for a volunteer. This is free of charge. So please do approach me. I will contact you with a coordinator, and you will go and see how it is happening there, and how much this doctor, medical assistant staying in a village really needs some help and needs to stay in touch. And it's not important whether this is a consultant from the US or a dermatologist conductor from another city or town. That is the human-to-human, peer-to-peer approach. So this is more a matter of management and healthcare organization. We really need to create the pool and to help the chief physicians to get the right teams. So this is a special art. So please, you are very much welcome. And this is a perfect idea. If you need to get those time slots for multidisciplinary slots, try and do this.
Дякую. Ну і останнє запитання.
And the last question for today, in terms of the follow-up and clarification, in terms of the supervision, I just wanted to ask, it's not a secret that telemedicine exists, but usually people think that telemedicine is for patient-doctor interaction, but we have the so-called second opinion. Could we use this for mutual audit and supervision? And the question is, how could we motivate and entrust this doctor to provide this consultation to that other doctor? Because apart from some material stimuli, we don't have any others. How could we actually build out and develop such a network where one doctor would be 100% sure that the other one would provide the second opinion on this specific case without going to a Facebook group and share the clinical cases and records there? Thanks for the question. The doctors who currently work in Ukraine, I assure you, they're not interested in the financial aspect first. The main care is a care about a person. And if a doctor has 5-10 years of experience, the main goal is to help those other doctors who have appointments and who conduct examinations. So I could even contact 100 of other doctors to get that second opinion. Should it be 2 doctors from abroad or virtual team consultancy, whatever. So it could be remote. And in terms of the clinical audit, who said that it should be a personal meeting? It could be from Berlin, from the US. Go to Skype or Zoom, switch on the camera and say, we need to brainstorm and to help your healthcare facility to increase the effectiveness, the staff expertise, because sometimes there is a lack of that expertise, true. So when we're talking about the reforms and we lack money, yes, but that what else is lacking? It's mostly the financial management. Then yes, let's come together, but it doesn't have to be a personal meeting if it could be solved with the digital too. Thank you. Thank you. Unfortunately, we have to stop the Q&A session here, and we need to move further on because we have an agenda, and the next stage is very important and serious work. So once again, I'd like to remind you of the cases that we discussed, and for you to select the most interesting, the most effective one for you. So as a reminder, we have 5 cases today. We have 5 effective, innovative digital solutions. Number 1, this is a healthy lifestyle presented by Andriy Skipalski. Second, early detection and prevention of diseases. Yulia Novak, presenter. For you to also understand who's the mentor on that. Mental health support, Alisila Dekbrazhalova. Convenient and safe interaction between doctor and patient. That was a very positive and funny presentation from Igor Zastavny. An effective interaction for doctors Irina Voloshin. 5 cases, 5 challenges, 5 innovative digital solutions that we're waiting for. Thank you to everybody who watched our broadcast. These are the 5 cases we're going to work for and look for solutions. We'll see you again during the final stage, the evening on Sunday, the 25th of September. So thanks you again to all our broadcast watchers.